the key to the hordeolium or Stye is that it's painful. It's really, really localized erythema. They tend to be, if a kid has had it before, they tend to have it again. Sometimes they can have multiple Styes, and that could be really like, well, what is this? It's like a bunch of red and weird pustules, like multiple ones. But some kids are just sort of prone to that happening. So if you hear of a kid who's had it before, or they're having multiple ones, they can happen multiple at a time. Diagnosis is you look at it and you recognize it.
I find that a lot of my patients are not using enough warm compresses throughout the day. They're just doing it like 1 to 2 times for maybe 10 minutes at a time. But I really like to hammer home with my patients that you really need to be doing these warm compresses at least 4 times a day for 15 minutes to really bring it to a head to allow it to drain.
Right. And one tip an ophthalmologist taught me was you could take a sock and fill it with rice, stick it in the microwave for 8 seconds, and because you don't want to make it too hot. And then once you check that the temperature is okay, you could actually use that as your warm compress. I personally like the idea of the moistness, thinking that maybe some of the water can wash away some of the physical obstruction. But the ophthalmologist said it's really the warmth that helps, which I thought was interesting.